All right, so first things first, COVID. This is what it is. This is what's been driving us all crazy for the last year and a half. It's a virus that gets into our bodies and predominantly causes lung-related infections. Sometimes you get pneumonia. Some folks have unfortunately required intubation and ventilation in the ICUs. And more often, especially among the younger folks, it causes some sinus issues, coughing, congestion, runny nose, things like that. This red thing sticking out of this picture is the spike protein, and that's what all of the viruses, that's what all of the vaccines are targeting. This red spike protein is the key that COVID uses to get into our bodies and to get into our lungs and to cause all that damage and to make us all feel sick. So by targeting that key, we're basically, shutting down COVID from entering our bodies and allowing us to get sick and allowing us to infect other folks. So there are 3 vaccines available in the United States right now, Moderna, Pfizer, and Johnson & Johnson. And I'm going to go over all 3 of them one by one, just so we're all kind of starting from the same spot and we all have the same information. I know some of this can be redundant because the vaccines have been out for a while. So I will try not to spend too much time on this. So the first is Moderna. It is an mRNA vaccine that targets that red spike protein that I mentioned. It requires 2 doses, 1 dose and then another dose 4 weeks or 28 days later, right? Like I mentioned, the spike protein is what we're targeting. The mRNA, which lives in all of our bodies, every single one of us has mRNA. It's what comes from DNA, and it's the instructions that tells our body and tells our cells, to make our hair black, our eyes brown, make us 6 feet tall or 5 feet tall. We all have it. We just created, the scientists out there just created mRNA that codes for the spike protein. It's the instructions that tells our cells how to make the spike protein, so that the spike protein is expressed in our bodies and our bodies can then recognize it and make antibodies to fight it. So if the real COVID with the real spike protein ever comes near our bodies, we know how to fight it and we can fight it quickly, and that way none of us gets sick. Pfizer is also another mRNA vaccine. It also codes for that red spike protein. The only difference is that it is given 21 days or 3 weeks apart. So a little bit of a difference in the duration between that and the Moderna vaccine. Otherwise, it's the same. That mRNA, those instructions for the spike protein is in the vaccine, gets into our cells, and that's what allows our cells to make the antibodies against that spike protein. And that if the real thing comes, we'll know, and our bodies can fight it off quickly and immediately. And the last vaccine is Johnson & Johnson. It's a little bit different. It instead of using mRNA, it uses something called an adenovirus vector. I'll get back to that in a minute. It sounds scary. It's not. But it still codes for the same spike protein. And the upside is that it's a one dose, one and done. Right? So what's an adenovirus vector? You'll see in these other pictures that the mRNA is surrounded by fats or lipids. For the Johnson & Johnson, instead of using fats or lipids, we basically used an old virus, the adenovirus. We basically hollowed it out. There's no virus in it anymore. We're basically just using the skeleton, the scaffolding, and that's what delivers the instructions, the DNA, the instructions that allows our bodies to create that spike protein. Only that spike protein, nothing else, just the spike protein. And again, similar to the other viruses, the Johnson & Johnson, similar to the other vaccines, the Johnson vaccine will allow us, make the spike protein, and then our bodies can see the spike protein and then create those antibodies that will fight it off. So again, if the real one comes along, we'll be able to shut it down immediately, and it won't even have an opportunity to make us sick. Okay. All right. Why is this important to get the COVID vaccine? Because vaccines work, all right? This is data way in the beginning of the year when we started rolling out vaccines in nursing homes. You might recall that when the vaccine hit, nursing homes had a huge number of deaths right up front because they tend to be older, more frail, have a lot of comorbidities that are associated with complications if they were to get COVID. So they were among the first folks in the United States to get the vaccine. So frail individuals who already have a lot of medical comorbidities were one of the first to receive this new vaccine. Not only did they tolerate it well, but you can see that the deaths declined substantially. So the vaccines work, and they worked in a frail population too. Another reason why vaccines work is something called herd immunity, which we've been hearing a lot about the last year and a half. I think this graphic illustrates herd immunity really well. You'll see that in a group of folks, the student who is a yellow here has COVID, he's infected. And if only a few people, so folks who are blue, if only a few people are vaccinated, that still leaves a ton of folks vulnerable. And it allows the vaccine to jump from person to person, and it allows the virus to spread and to get a lot of people sick pretty quickly. But if you look at the bottom panel, if that one person has the COVID infection, and remember, this could be someone who's asymptomatic. They might not even know they have COVID yet. But if there's a ton of folks who are vaccinated, you're kind of boxing them out, right? Like the COVID can't jump to this person because they have the antibodies. It can't jump to this person because they have antibodies. Their options are limited, so you kind of box out the virus and you keep them contained, and it can't spread to a ton of folks. So you'll see a lot less folks become infected down in this bottom panel compared to the top one. Not as many folks are vaccinated. A lot of studies have been done, and the thought is that 70% is the magic number. 70% is what we need for herd immunity. I don't want anyone on this call to get caught up with that number, because the truth is that number is different for every virus, depending on what we're talking about, depending on how contagious that virus is. That 70% number will change. It applies for most infections, for most viruses and bacteria, but and it's a good number for us to kind of strive towards, but it's definitely not where we want to rest our laurels on. We want to get to 70 at least, but ideally as a community in Revere, whether you live or work here, we should all be striving for 100% vaccination rate. And that way we can, or at least as close to 100% as possible. We know there are some folks who are immunosuppressed and can't get the vaccine, or the vaccine won't work as well for them, say if they have cancer and they're on chemotherapy. And then there's also folks less than 12 years old who can't get the vaccine yet either, because we don't know yet if it's safe for them. So, as many folks as we can to get on board and to roll up your sleeves and get the vaccines, the better. Alrighty. So far, as of last week, the city of Revere is at 44% fully vaccinated. And again, we're aiming for that 70. It's a good number to aim, but we're hoping to break that to break that number and break that record, so we can all stay safe this summer and stay safe heading into the new school year. All right. I want to end my portion before having Lauren take over the end. Going over a really common question that I get. A lot of my patients always ask me, I have a history of allergic reactions, or I've had anaphylaxis to peanuts or antibiotics or other. What do I do? Can I still get the vaccine? And the short answer is yes. Yes, you can still get the vaccine. It's actually available online. Every single ingredient in all three of the vaccines are available online, and it's pretty benign. It's just some lipids or fats, which are already in your body, the mRNA, which all of us have in our body, and sodium and other kind of electrolytes. There's not a lot that can cause a reaction. So even if you have a history of anaphylaxis or allergies to foods, to allergens like pollen, to antibiotics, none of that is in this vaccine. So you're good to go to get it. The other thing too is, reactions to vaccines in general are quite rare. We know this from just, having the flu shot and the tetanus shot and, a bunch of other vaccines that we give to all of our patients and that we have been giving for decades and decades. I also wanted to pull up some other information to give everyone in this chat some perspective on what we're seeing in terms of allergy rates currently for the Moderna and the Pfizer vaccine. So for the Moderna vaccine, the CDC has reported that the rate of allergic reactions is about 2.5 per 1 million doses administered. The Pfizer vaccine has a rate of reaction at 5 per 1 million doses administered. To put that in even more perspective, the CDC has the odds of getting struck by lightning in the US to be about 2 in a million. So we got kind of similar odds as getting struck by lightning for getting an allergic reaction or anaphylaxis to either vaccine, either of these two vaccines I've listed. I don't have too much information on the Johnson & Johnson vaccine. I was searching, I couldn't find it. So unfortunately, I don't have that, but I could probably get it to you guys later if you give me the weekend to look. Another interesting thing, the IIHS records the rate of fatal car accidents in the US as 110 fatal accidents per 1 million people. So that just blows that statistic out of the water. Your rate of getting into a car accident in the US is actually much, much higher than having an allergic reaction to either COVID vaccine and obviously to getting struck by lightning. And the IIHS puts the rate of fatal car accidents in the state of Massachusetts, so us specifically, as 48 per 1 million people. So still much higher than the rates of the vaccine. So I think, with something so new, it can be easy to just focus on these allergies and all the potential downsides, because that's what the media and the news is reporting. COVID is really the only thing that a lot of folks have been able to talk about for the last year. But I just wanted to make sure we put it all into context, because I find that that's super important. And I think that's it from my side. So I'm going to hand it over to the Director of Public Health, Lauren Buck.
Hi, guys. I'm calling in from the Susan B. Anthony gym. So I'm so sorry if there's a lot of background noise. We are currently doing a Pfizer clinic for our students at RPS. So that's really exciting. And I will try to be quick. So I'm sure it's a little distracting with the noise. So I want to just talk about when you're thinking about getting a vaccine and when you're contemplating, if you're hesitant, if you don't have a lot of confidence, if you have questions, make sure you're looking in the right places for the information about the vaccine. One of the best places is your primary care provider. That person knows your medical history really well and also is up to date in the most recent evidence-based data that we've seen about the vaccines. Other places to look, I've just put a couple of places up here. The CDC actually has a whole webpage that's literally just myths and facts about the COVID vaccine. It's a great place to go if you're trying to get questions answered. And then Harvard has a really good health blog. If you just search COVID-19 vaccine, Harvard health blog, it will come up. It has lots of great articles and answers to your questions. The reason that we talk about looking for good sources of information is because there is so much misinformation out there, specifically about these vaccines. Not good sources of information, friends who are not medically trained, news or articles or potentially stories that you find on the internet that aren't verified or don't have substantial experts that they're using as their references. So it's really, and we hope that this is actually a good source. Dr. Kong and I are both pretty well versed about these vaccines. So just be particular about where you look when you're looking for information. And these are two pretty reputable places to go. You can go to the next slide, Dr. Kong. So here's an example of something that got a lot of media coverage, and obviously the Johnson & Johnson pause that we now all know about that happened about a month and a half ago because of blood clots. A lot of reporting about it that happened. There was a pause for about a week, and then the CDC and FDA said okay to continue with the Johnson & Johnson vaccine, as long as women who are under 50 understand that there's a very rare risk of a very specific, unusual type of blood clot that happens from this vaccine. This slide is just trying to illustrate, and it's very similar to what Dr. Kong was talking about with the allergy slide. It gets a lot of press coverage, right? Like the Johnson & Johnson vaccine gets a lot of press coverage about clotting. But if you look at the risk of clots from the Johnson & Johnson vaccine, it is so small compared to with these other three things, the most significant of which is COVID itself, which is a very significant, there's a very significant risk of clotting from COVID. And it's just, again, this is just trying to illustrate the fact that what potentially gets covered significantly in the news is, or what you hear about so much, isn't necessarily the thing that we really should be focusing on. Obviously, talking with your doctor about specific medical conditions, about specific medical concerns is always how we want to go. And if you have a specific concern, that's where we would want you to go to get your answers. The great thing right now is there's a lot of choices, even in Revere, about where to get your vaccine. So picking one or the other should not be a barrier for you to get a vaccine right now. You can get any vaccine you want very easily. You can go to the next slide. Okay, so we all want to get back to normal life, Fenway without masks, traveling, movie theaters. This is the herd immunity kind of concept that Dr. Kong just talked about. How I like to describe herd immunity to people is, and I used this on some high schoolers, and I think it went over well. Dr. Kong and I were on a presentation maybe a week ago with the Revere High School students. That scene that's in Finding Nemo, where a bunch of fish get caught in a net and they don't want to die. So what do? They all swim in the same direction down. What happens? The net breaks. That is exactly what herd immunity is. All of us moving in the same direction to break the cycle of infection. That's what you have to think about when we're trying to reach these 70% numbers, these 80% numbers. It's all of us moving in the same direction. So the COVID virus, the infection has nowhere to go. And that means that it requires some people who aren't as passionate about getting it, who might be a little bit more concerned, but we're all doing it for each other too. There's a component of that in herd immunity. We are protected by many other diseases because all of us have done it, have been vaccinated from other diseases, and we just don't think about them every day. And COVID is top of mind. And so that's what I want you to think about when we talk about this herd immunity. You can go to the next slide. So this is basically I just want to kind of lay out just how easy it is to get a vaccine in the city. There are lots of places to go. Wednesday nights at RMA, the same people who run the Sunday clinics are opening up a second day. That's going to be at RMA. Thursday nights at the beach is starting in June. So that's going to be 3 to 7 at the beach. Sundays is going to continue through June. CVS, Stop and Shop, Walgreens, Seaside Pharmacy on Shirley Ave. All of these places have vaccines, and most are same-day appointments or walk-up available. If you have any other questions about where to go to revere.org/vaccine. Our vaccine calendar is up there, as well as some other places you could call to schedule.